Good afternoon, everyone. Thanks for tuning in to today's Health Department briefing. We're glad to see that additional testing is still taking place in the community and giving us a stronger idea of how the community is doing in our combat against COVID. As we all know, there's been considerable discussion in our region about getting our economy started again. I hear that the governor just had a very interesting press conference. I have had an opportunity to speak personally with him a couple times over the last week, and we this afternoon submitted a draft of our plan that we're looking for feedback for. The governor was anxious to see that. We're looking forward to his thoughts on that so we can potentially get Central Illinois back on track again. I would like to report that we had a very good call with mayors, Central Illinois mayors, and Representative Bustos today, more along the lines of discussing the next federal stimulus that hopefully will impact communities our size. I've also talked with Congressman LaHood, who's actively engaged in that discussion and doing a lot of work on behalf of the smaller communities that have not gotten any relief or any money from the federal government to this point. So we're going to continue to work on that. Now I'd like to introduce Monica Hendrickson from the Health Department.
Thank you, Mayor Ardis. We begin with our to-date totals for the Tri-County region. We have 175 cases to date, 112 in Peoria County, 50 in Tazewell County, and 13 in Woodford County. I'm also sad to report an additional death in the Tri-County to a Tazewell County resident, a female in her 90s with underlying conditions, and did reside at a long-term care facility at Generations Riverview, East Peoria. That brings our to-date totals for deaths in our Tri-County to 8. Of our cases in the Tri-County, 91% are considered recovered, 26% are at home and in isolation, and 9% are still hospitalized. As of 3 p.m. today, Heartland Health Services reported 112 tests between Carver and their East Bluff sites. In regards to the hospital data, OSF St. Francis Medical Center, Unity Point Health Peoria, which includes Methodist, Proctor, and Pekin, reported 19 ICU beds in use, 12 for individuals confirmed with COVID, and 7 for persons under investigation. Additionally, there are 32 individuals not in the ICU, and then reporting 1 new death in the Tri-County hospital systems. As we talked about recovery and the individuals that are currently in our community, the 91%, part of that also speaks to the aspects of plasma donation and what it means in terms of a treatment or an assistant in terms of critical care. To talk more about how, as a region, we're approaching this is Dr. Teresa Lynch, who is the Interim Department Chair of Internal Medicine at the University of Illinois College of Medicine.
Thank you, Monica. I'm very happy to be here today, but not happy to speak on a difficult topic. I did want to take a moment to thank Monica for her and her team for her leadership. She's given us a lot of great scientific data and guidance on how to proceed in our area, and it's been very helpful within our healthcare systems to help guide patients and their families in managing this outbreak. I come to you today to ask for your help. As a representative of the community of healthcare providers, the University of Illinois College of Medicine Peoria, OSF, St. Francis Medical Center, and Unity Point Health. I serve as a hospitalist at St. Francis Medical Center. I also supervise resident doctors in training at Heartland Armstrong. And mainly today I'm here to represent our patients who are alone and suffering from COVID-19 in our hospital. At recent press briefings, Monica has mentioned that a lot of our COVID-19 patients are now recovering at home. And so it's really to those recovering people that I would like to speak to today. As you all know, there aren't a lot of treatment options for this disease. One of the options that has worked in the past for other illnesses like influenza A, H1N1, SARS, MERS, even been tried in Ebola, is plasma. So plasma is the liquid portion of a person's blood. It holds the immune chemicals and specifically antibodies that fight disease. And what we have found is that when you take people who have recovered from a disease and give their plasma to someone who's suffering from the disease, oftentimes their immune chemicals, their antibodies, can help to fight that. We have seen with COVID-19 that we've had some good outcomes from the use of plasma. As a result, our government has created an expanded convalescent plasma program that urges people who have recovered from COVID-19 to donate plasma to give to patients. UICOMP physicians in internal medicine and physicians from St. Francis and Unity Point Health have enrolled with Mayo Clinic, which is a big leader in this convalescent plasma program. And through Mayo Clinic, we've been able to provide plasma to some of our sickest patients. And these are our patients who are currently in the ICU. Many of them are on ventilators, or those who are declining and nearing ICU stage. What we're hopeful is that this message will get out to those of you who have recovered from COVID and that you will consider donating plasma. We have created, through the University of Illinois College of Medicine, Peoria, a team of resident physicians and attending physicians and medical students who can answer questions about plasma donation, tell you if you're eligible to donate plasma, tell you what the process would be like. One of our area blood banks, Mississippi Valley Regional Blood Center, is also enrolled in the Mayo program, and of course, American Red Cross is the heart of helping our COVID-19 patients. We have a phone number that you can call into, 309-413-1003, from 9 to 5, Monday through Friday. You'll be able to speak with a qualified healthcare professional who can speak to you about the benefits of donating plasma, can help you determine if you are eligible to donate, and can even tell you where the nearest donation facility would be and what it would entail for you. Thus far, we have been fortunate to treat probably about a dozen people in our area and have seen some promising results. I'll leave you with the idea that one person donating plasma can actually provide treatment for 3 individuals, and we can only help people if we donate. So please consider your donations. Thank you so much. Oh yeah, I'm so sorry.
I do.
Yes.
Could plasma donations also be used for future vaccines?
I'm not certain that they would be used in creating vaccine. It is a form of sort of passive immunity, so it's kind of like giving a temporary vaccine to people by giving them immunity for a period of time.
So when we talk about seeing positive results in some of the dozen patients or so here locally that have undergone this convalescent plasma therapy, can you expand a little bit about what positive results are we seeing? Are we seeing quicker recovery time, less severe symptoms? What kind of results?
Sure. So some of this has been studied by researchers, and they've seen recovery of symptoms. They've seen resolution of some of the pneumonia findings in the chest X-ray and CAT scans. They've seen resolution of some of the lab abnormalities, so return to normal of some of the inflammatory abnormalities and some of the blood cell abnormalities. For us locally, we've seen patients get extubated or get taken off of the breathing machines. And then I think one of the more promising things is we've seen clearance of the virus from the blood. So we've seen, in studies they've shown that where before we could detect the virus in the blood, the virus has become undetectable. And also seen antibodies to the virus in the patients who were treated.
So I know you mentioned Mississippi Valley and American Red Cross. I know they're also doing this. Just to clarify, you're all working in coordination here with Mayo Clinic. So if I go donate my blood at the Mississippi Valley or the American Red Cross, and I was a recovered COVID patient, it's all going to go to the same place, essentially.
Essentially, yes. So it's really across the United States. The more people that we can get to donate, it's almost, if you think about it, like for our patients being on a transplant list, it's, you have to be very sick and have qualifying factors, and then have the appropriate match available. And then you would get the plasma. So, we can't sort of designate the people who donate here for our patients here, but the more people we can get to donate, the more people can get treated with this. Correct.
Thank you.
Thank you very much. Thank you.
And I would also just like to highlight that this is a great just a leadership from the University of Illinois College of Medicine and between the two healthcare systems to coordinate approach, so that as individuals in our community, we don't sometimes recognize all the various nuances, and for University of Illinois College of Medicine to kind of take on that role, it helps assist us in kind of having a unified message to our community. So with that, I'll open up to questions for myself, and I believe Mayor Ardis is also available.
Monica, did you say that there was another death, but this person wasn't from the Tri-County, or was it the Tri-County hospital system?
So the question is about the death that's reported in the past 24 hours in the hospital systems. That death is within that Tri-County, within our Tri-County, so it is attributed to the Tazewell County resident.
Oh, okay.
Monica, big announcement from the governor today, looking for your response, and then response from Mayor Ardis as well. But since you're up here first.
So in regards to the governor's message today about Restore Illinois, and even the comments that Mayor Ardis spoke to as well, I think both we see at the state level and then locally with Mayor Ardis and Chairman Rand that the conversation's always been that we want to make sure we are doing data-driven approaches. And so I appreciate that there is a measured approach and one that looks at the data of our community so that we can provide a healthy and safe way towards reopening. And the plan that Mayor Ardis spoke to, I think what I appreciate as a local health department is that the leadership from our city and our county to making sure that the health department was at the table, our healthcare community was at the table, so that we were doing it in, again, a safe and healthy way for our community.
The governor mentioned some specific parameters that he was looking at for when we can go into these different phases. According to the parameters that he talked about, are we in a different phase now than we should be in?
So the question is about the parameters that the governor spoke of in terms of how you move from phase to phase. That includes ICU capacity. It also includes positivity rates and testing capacity. Where we stand locally, and that's really in a tri-county aspect, recognizing the fact that the current plan that the governor proposed was a larger geographic area, but that localized area, we are within those capacities. Our positivity rates are below 20%. Our ICU usage is also within the parameters discussed by the governor's office. And I would take it a step further. We've been monitoring, and as we reported, those COVID-like illnesses within the ICU. So we've been trying to measure that even here locally more robustly at times, just because if you have 100 beds in a hospital system and you feel comfortable that you want to have 50, anything below 50 makes you comfortable as a hospital system in terms of your capacity, that's one thing. But recognizing the fact that ICU beds are used for a plethora of critical needs. And so if all 50 were for COVID only, that changes how the healthcare system views that ICU capacity. So we were making sure that when we discuss these kind of regional approaches, what it looks like. And I think all those measures, it's been on the state website, and we've been reporting to that locally here. So we feel comfortable where we sit right now. But again, that's for the Peoria specific region. I can't speak to all of our partners across the state.
So the measures in the Peoria region, would that take us into phase 3? I mean, according to what he's talking about, would we be in phase 3 by now?
I think we have to look at all the measures that were proposed. Like all of you, we received that plan just a few minutes before the release. But I think, again, just recognizing where we sit on those larger measures from a healthcare capacity standpoint and the traceback capacity of your local health departments, which we've been reporting on, I think from the Tri-County region, we're in a good place. But again, we do want to have that direction from that larger regional approach. What does that mean? As well as understanding what the governor really is looking forward in this capacity.
Because we're linked in with a lot of northern Illinois. Is that right? We're all the way up there with Rockford in this phase plan, I think.
I believe we are part of the EMS2 region, which takes us all the way into the Rockford region, and not further south than maybe Fulton County.
So would that affect, are they worse up there? Are things worse up there that it could hold us back from going into another phase?
So I can't speak to the other regions of the state. I mean, I've been monitoring them, but really my understanding is more deeply rooted in the Peoria specific area.
So we know Rockford statewide has been a hot spot. So if we're looking at Rockford, Rock Island, Leamington, Macomb, Peoria, all as one massive region that all has to meet the standard, then I mean, Peoria on May 29th, which according to the governor, the clock started May 1st on phase 2, so to speak. So the earliest anybody can go to phase 3 is the 29th. So if we are at a point on May 29th where we fit these metrics, we're at the level basically where we're at right now, where we're in a good place, but Rockford is not. I mean, I know you got this plan about the same time we did, so it's a whole lot of question marks, but could that potentially mean we're still in phase 2 even though we fit those parameters because somewhere else within this designated region does not?
So I think the question is, when we look at those regions and there's different pockets of capacity issues, what does that mean for the full region? I think the governor left some of it open to interpretation, but I think that's maybe a better question for Mayor Ardis, who has spoken to the governor a little bit and proposed our localized plan. So do you have maybe some feedback?
Thanks for that lob, Monica. We haven't talked about that specifically, and really, the information that came out right before we started was the first time we've seen it too. So I think that it just leaves a lot of potential for discussion there.
Can you talk a little bit more about what plan you submitted to the governor, and you talked a lot about medical metrics in the last week or so. Can you just talk a little bit more about it?
So as we started discussing a plan to put in front of the governor that would give Central Illinois potential head start on this because of all the measures that have been put in place, the team decided that we should really try to base as much of this on the medical metrics because that's what he has really been establishing as the foundation for his decision. So not to toss it back, but Monica can give you a lot more of the specifics that we put in that, but they were very, in my lay opinion, very well thought out. They fit the criteria that the governor's been using up to right now, and it's also with considerable discussion with the healthcare folks at specifically Unity Point and OSF in terms of their beds and the ICUs and the vents and all that stuff.
So then, Mayor Ardis, I guess correct me if I'm wrong. So you sent that plan today. He comes out with this announcement. Clearly, what he sees as the plan. How different would you say that your plan you sent to him was from his plan, and does the geographic thing that we just spoke about kind of put a kind of some difficulty in that?
You know, that's what we're going to find out about it. When he had mentioned when we talked yesterday that they were working on this plan. Wasn't sure exactly when it was going to roll out. We were a little bit surprised that it came out today, but I do think that just in a really quick glance with Monica and the city manager before we came in here, a lot of those areas that he's identified fit very closely with the areas that we've identified in the time that we should be in those and the metrics that we need to get out of those and towards the next one. So I don't know that they're going to be all that radically different. So again, we're hoping to, after this meeting, to be able to sit down and compare them side by side and see where there's potential for movement.
Are you concerned about the fact that we were lumped in with Rockford?
Yes.
And this is new? You haven't heard of it before?
Well, they've been talking about, not based on necessarily physical geographic regions, but medical regions, which have been established for quite some time. So they're trying to. I think they're trying to work within existing boundaries. I get that part of it, but when you talk about a hospital system that's that far removed from ours, and we have this much available capacity here, that worries me that we would potentially be held back until they could get caught up with us. So I'm not sure if the governor's actually had that consideration yet, or if he would consider maybe making those tweaks in a situation like we might have there.
So I know you said there's a lot of medical metrics involved. I guess if you can give us any more specifics about the plan that you sent, I guess, for example, comparing it to some of the things laid out by Mayor Call in East Peoria. What are some differences in this Peoria plan?
So I couldn't cite, a lot of the specifics on what the other mayors were proposing. And again, I've said publicly, I think they're on the right track. And the biggest thing I think that was missing from that plan was the metrics that the governor's looking for. So, when it's kind of like the golden rule, the guy with the gold makes the rules, and in this case, it's the governor. And so we tried to fit our plan into how he's been looking at this. So the biggest difference in our plans aren't if it's 2 weeks or 3 weeks from when a bar or restaurant can get started with pickup service to when they can open up to 50% capacity. There's not a lot of differences there. There's considerable more weight given to how we measure that we're there successfully and that we're not putting more pressure on the health department and on our hospitals.
Could I just ask, you mentioned a few days ago you've been working on this plan in conjunction with the health department, Chris City at the EDC, the city manager. I mean, is this specifically the city of Peoria's plan? Is it Peoria County's plan? Is it the TriCounty plan? Who all does it encompass, I guess?
Well, I would, not that we've put a name on it, but it's been Peoria County, city and county folks. Not all elected, a lot of it's, medical professionals and so on. So it's not a whatever the medical region is that the governor's talked about. It wasn't that at all. It was Peoria County.
Tazewell County as well?
It's been Peoria County that.
Because Tazewell kind of split and are kind of doing their own thing.
Yeah, and again, I don't think this is so much about whose plan is going to get approved. I think it's having the governor consider something that would fit into this area. And we're not saying it's just for Peoria. I hope all of our area could participate in this, so we can get the whole area up and running again on a basis that's thoughtful to the health of our community as a whole.
Does it cause some difficulties that we've had some, Woodford County saying, oh, we're not gonna do this, there's bars opening up over there,
Mhm.
there's a lot of activity over there. Is that gonna kind of weigh in on the governor when he, is this gonna cause difficulties?
I think it's caused. I don't know if it's weighing in on the governor or not, but in terms of just the local leadership, we especially get a lot of those questions from a business in Peoria versus a business in, Tazewell or Woodford County. Well, how come, and we kind of had this discussion a little bit on Friday at the press conference, is, well, how come they can do it over there and we can't do it in Peoria? And it's, at the end of the day, the mayor does not have the authority to override an executive order of the governor. We don't. So business owners who are dying to get open up again, and it breaks my heart and it kills me that they can't get back open again. But we don't want to be in a position to say we're going to look the other way or go ahead and do it if there's going to be a repercussion to them or expose them to just another liability that they don't want. So that is what's really been hard, is that misunderstanding on the part of the business community about what they can and cannot do.
So then, Mayor, sorry, I feel like I keep asking the same question, but I just want to be clear. So is your hope that Governor Pritzker will look at your plan and say, you know what, looking at the medical metrics, looking at our, under 20%, that maybe Peoria can be grouped with a different phase as opposed to this one that goes all the way up to Rockford?
My hope would be, and look, there's no, if he says, just sits down and says, there's a lot that we can work together with on this and make it work, we're all in. That's all we're looking for. We're looking for an opportunity to, call it compromise, call it whatever you want. By just glancing at his plan and knowing where our metrics are, I think we're considerably ahead of the starting point of a lot of communities in the state. And it's for good reason. It's because we've really been working it hard. So I'm hoping that we don't have to go back to start this whole process when realistically we're considerably farther ahead than others are. But those are just things that, I'm confident that through our state legislators, our state representatives, and just conversations that we've had personally with the governor, that we'll be able to have those conversations. I don't have a strong feeling whether there's going to be any room for movement or not.
Mayor Ardis, what have we been doing right in Peoria County that you think has gotten us to this point?
I think for the most part, they're real strict focused on the sheltering in place, on the distance requirements. A lot of people really don't understand, and this is, you guys don't need me as an assignment editor, but the people in our community really need to understand better is the importance of the contact tracing that's being done here in Peoria County. And that has kept us ahead of a lot of potential spreading of COVID. And that's because Monica's folks here have a huge edge on people in Tazewell and Woodford. They just are. They have more resources and they're very good at it. And that's one of those things where people wouldn't, if you were going to ask that question, people wouldn't think that it was something not as basic as that, but it is pretty basic. It's given us a huge edge on pushing back on people that were potentially exposed.
Mayor Ardis, we've seen that you've taken a position with OSF Healthcare. Out of curiosity, are you running for another term as mayor of Peoria?
Well, we don't have to actually put our petitions in until October, November. So as of today, my thoughts are that I will be running for another term, but we have a long time until that happens.
Looking at the timing that the governor was talking about, I was sort of confused because he was saying, you have to have this for 14 days before you can do this, and yet the first time we can do something is the 29th of the month, which is like 3.5 weeks from now. So were you a little disappointed with that timing that he's talking about, considering the fact that we're kind of within the parameters now?
Again, I didn't have very much time to look at it as I was walking in today. And if there isn't some flexibility given for the communities that are already there, I would be very disappointed. And it's hard to, it's kind of like that thought process that we thought we were all in just a few days ago, that it was everybody is in the state of Illinois. We're all doing this together. So I give the governor credit that he's thinking outside of that, because who knows? I mean, it could be it could be the 4th of July. It could be August before the city of Chicago is ready to come out of this, and the rest of the state. That couldn't happen. So I guess that's yet to be determined by the discussions that we'll have with the governor to better understand his plan. Okay. Thank you.
Are there any additional?
One more for you. The mayor mentioned you might be able to talk a little bit more about the medical metrics in the Peoria County plan, like what benchmarks you're looking at. Could you elaborate on that a little bit?
So when we were looking at the benchmarks, we really grouped them into 4 larger categories. One was healthcare, another looking at your public health aspects, PPE or personal protective equipment, and then lastly even community engagement. So from the healthcare standpoint, we were looking at ICU utilization, both overall as well as for COVID patients. Ventilator utilization, again, overall, and then specifically for COVID individuals, and then even just hospital admissions, kind of what that census looks like, again, overall, and then for that COVID-like illness, because we want to make sure that there is that flexibility of understanding that you are a critical hospital system. In our region, we have 2 of the largest hospital systems that individuals outside our region come to get care for. And so we recognize the fact that we want to make sure that they're within a capacity, but also being able to address this really highly contagious virus within their framework. The other one was public health surveillance, which I appreciate what the mayor spoke about contact tracing. Right now, when your virus is spreading so quickly, you really have to put on a large, you call it an axe. You're using an axe pretty much to perform a surgery, but when you have more and more contact tracing and as cases increase, the best way to get ahead of this is to have very strategic points of taking and identifying an individual and following those contacts quickly and bringing them kind of out of play, so to speak. And so contact tracing, the ability to respond quickly to contacts is going to be imperative because as you open up and relax restrictions, your contacts, we've talked about this, increases, right? How many people you see today, and if you went to a different capacity level, how many people you're hanging out with tomorrow is going to be completely different. So contact tracing was really important, as well as things such as testing positivity rates, which looks at not only new cases, but your overall testing capacity. And then lastly would be just your trend lines. Do we see it being stable? Is it flattening or is it decreasing? And this one's really important, especially in the southern and central parts of Illinois, because as testing increases, we're going to see an increase in cases. But we're not saying that increasing is bad. We're just saying it needs to be a stable increase. We're not seeing some of this exponential growth that's outside of our capacity. So those are some of the public health measures. PPEs, I think what we always are concerned about is making sure those first responders, our healthcare providers, congregate living and long-term care facilities have enough PPE on hand so they're not running short, especially based on the Restore Illinois plan. There's a lot of universal face masking or in those businesses as well, or those facilities. And then lastly, just community understanding. I agree. I think as Peoria, we've done a really great job, going out, you see individuals wearing masks, participating in social distancing, so how well we continue that. But also understanding those kind of measurements, such as absentee rates. We have to think about the fact that just because we reopen does not mean that the virus disappears. It just means that we are slowly phasing in an approach where we feel that we can maintain and control it appropriately so that our care systems are still at capacity and able to handle that, but as a community that we are putting in interventions to kind of minimize that. And so, again, we want to see how the community engagement, and so absentee rates would be something that we'd look at. So all of those measures, it's not an exact science, but recognizing the various levels are what we wanted to make sure. And I know the mayor said, and we've said it here in Peoria, is that public health is always going to be providing you guideposts. I mean, that's our goal in public health. We're not going to say yes, no exact aspects. We recognize that people have their interests. People have what they like to do, not like to do, but we want to give those guideposts. And I always give the example of if we took public health and did what is 100%, whatever public health said is exactly what we're going to do, there'd be no need for tobacco at all. But what do we do have? We do have tobacco, but we have guideposts. We have age requirements, tobacco 21. We have warning labels. We have other issues that come into play, cessation programs. So public health, and I appreciate what Mayor Ardis and Chairman Andrew Rand did, which is they asked public health and healthcare to create guideposts to safely reopen our area, and I think our plan does that.
Monica, on testing, I'm still looking at the parameters, the 3.5 weeks that the governor's kind of talking about. And when you mention testing, it makes me think that maybe one of the reasons why he set that timeline was because testing is still kind of being implemented around the state.
So the parameters are exactly 28 days. And that's because it's 2 incubation periods for the virus. So the best way to think of it, I'm going to kind of geek out here as a public health science person, but you do an intervention, and then you want to test it out, right? You want to give yourself enough time. So we're going to start an intervention on day 1, and with this virus, your incubation period is 14 days. So we were all exposed on day 1 together, we have 14 days based on this incubation period to get sick, which means on day 14, maybe one of us gets sick, and then all of your contacts are then have another 14-day incubation from there as well. So that 28 days is actually 2 incubation periods of the virus.
Okay. Well, I guess my question was though, you know, he's had like 3.5 weeks before we can really do anything. The 29th was the first that anybody could move into another phase, which, you know, we question because we're kind of in a, you know, pretty good place here. But could he have set that way because testing really just ramped up a couple weeks ago? And in some parts of the state, you know, they're still waiting to get, you know, vibrant testing going. That would be a kind of a guess on your part, but could that be one reason why he set that date for 3.5 weeks?
So I think there's multiple reasons why that the 29th was set as a date, but I know in our discussions here locally, one of the things we always talked about was making sure that we had enough time to see that our interventions or our phases are either creating a continuation or improving, but not making it worse. And really that goes back to your incubation period. And so I see the 28 days more of as an incubation period. Now that's for if you are going for the extremes, which is a 14-day period. What we are seeing in this is that the average incubation period can be anywhere from 7 to 10 days. But I think when you're talking about a statewide plan, you know, setting it at the largest capacity would have been what I saw from that number.
But testing is kind of key, and in some communities, we haven't had a lot of testing, so we don't know exactly what the virus is doing in that community, right?
So the question is, you know, not having enough testing, what does that kind of mean in terms of our communities? And I think where you see that in the plan and kind of that measurement is positivity. So the positivity rates, I believe in the plan is asking it to be under 20% to move to the next phase. If you remember here before we had Heartland Health Services providing a lot of our testing, our positivity rates were in the teens. We're now dropped down to 6%. And so I think they left a large enough value or a measurement around positivity to recognize the fact that there's going to be a gearing up of testing capacity.
In other areas of the state.
Exactly.
Okay.
So not setting that positivity to a point against a community that had a lot amount of testing, but recognizing that you want to set a range that acknowledges the fact that testing is going to also ramp up and it's going to decrease as you move through phases.
So every region is in a different space right now. I know you and Mayor Ardis have said that Peoria County or our region has just been doing a good job. He also said that it might take the Chicago area, a while to come out of this. I wanted to know if we continue to move forward and move up on this phase plan, but other people are left behind and they continue to, or try to travel to places that are doing well. Are you worried that that'll be bad for our region?
So if I can summarize the question, I think the question is the concern of in communities that have been working together and addressing a response really well, and other communities that are now trying to maybe jump ahead, what kind of impacts might that be at that local level? And I think there's definitely an impact. We want to always monitor those measurements to see how non-compliance can change where we sit. But I think most importantly what this plan provides, it allows for us to know that there is a next step. I think that was a lot of the discussion we saw from business entities, from even as health departments, and even from our COVID positive patients, understanding like what is that next step in this full plan. And I think it allows us to have that step. So I feel like when you see a plan like this, you're also going to get a lot more understanding from entities that were thinking about being non-compliant, because now they recognize that there is the next stage. And I think the thing that we have to recognize is for us to move to that next stage, it does take a community-wide response and an agreement that we're going to adhere to these phases so that we can move together to the next one. So,
Monica, one quick question.
okay.
A lot of people on social media regarding the face coverings are wondering, you know, is this only going to be a 2-week thing? Is this going to be a 3-week thing? Or is this something we're going to have to start pairing with our summer fashion? What is kind of the guesstimate of how long face coverings are going to be necessary?
So the question is, you know, how long will face coverings be necessary? And I think it's one of those non-pharmaceutical interventions that we have to start figuring out as a new normal. It may go from a requirement to strongly encouraged, but I would just indicate the fact without an aggressive treatment or a vaccine program, we're going to have to start getting used to these non-pharmaceutical interventions, such as face masking, such as social distancing. And regardless of whether there is a vaccine or not, remember to always practice good hand hygiene. So, well, thank you, everyone. I'm guessing tomorrow we'll have more detailed questions about the plan.
Thanks, Monica.
As we all actually get to read it.